I'm Dr. Kelly Starrett with H-Wave. One of the questions we get is how easily does H-Wave stack into other modalities? Oftentimes when we're seeing athletes or patients who've had shoulder surgery, that shoulder is immobilized for a reason. We're trying to protect those repairs. We're making sure that we don't add speed and sort of load that challenges a fresh repair and attachment, sort of a healing process. But oftentimes we know that it's difficult for us to get enough movement in the system, enough sort of load to maintain muscle mass, to improve blood flow, to decrease waste by moving out congestion, just the normal congestion that would be related to any sort of surgical trauma or insult. So one of the things that we tell everyone we're working with around H-Wave is, hey, it should never be uncomfortable when you're attaching the lead. So if you're pumping any aspect of the system, right, that never ever should it make your feelings about your incision or your surgical site or anything uncomfortable. So if it's uncomfortable, we move the pad and try to pump something else. Oftentimes, people are a little bit reticent about attaching leads in and around a fresh bandage, and I think that's very reasonable. But we always want to remember that the whole lymphatic system of the body is actually draining in a chain up to a kind of a specific point. In this case, it goes everything from the fingertip all the way up through the musculature of the arm, goes up into the armpit. Same thing from the foot, ultimately ends up in the drain in the groin. And so what's nice is I have all the rest of this regional musculature to mess with. So if I don't want to mess with my rotator cuff or shoulder, I certainly can just continue to pump downstream. But one of the nice things we're seeing is the intervention and the sort of more widespread adoption of blood flow restriction techniques. A lot of people are getting comfortable with using KATSU, and certainly we're finding that early intervention with a blood flow restriction cuff, even just passively waiting around for 10 or 15 minutes of just very low pressure, can really help with pain, help with perfusion, sort of maintain muscle mass. There's a lot of amazing things that can happen with this blood flow restriction. Well, turns out in this situation, I've got this set up just on forearm, biceps, and triceps. I'm staying away from the shoulder, but you can see I've got muscle contraction going on in the limb now. If I just pump this up to a very low level, our clinical guidelines are very low, below loss of pressure. And again, you can talk to your physical therapist about this. We tend to stay only in the regions of 80 to 120 millimeters of compression for when we work with the upper body anytime. But here I've just got 80 in, which is very low. I feel very comfortable. I can easily keep this on for 15 or 20 minutes. And if I'm immobilized and I can get a blood flow restriction cuff on plus some movement in these systems, right, even in my immobilization, this is me getting a lot of movement and a lot of sort of physiologic benefit with the blood flow restriction cuff. So it's nice is that I can easily stack this. Now, I'm not going to get the kinds of muscle building that I would normally see with blood flow restriction and low load. But in this situation, I'm trying to improve blood flow and hemodynamics. And so with the blood flow restriction, I'm really working on making the body have to reperfuse these sort of surgical areas and downstream. Plus, I'm going to get all the benefits of the pumping through the muscle contraction, the low-grade movement. Plus, I'm also going to get all the anesthesia benefits that happen when I decongest an area, plus the addition. So what I'm saying is, feel free to begin to talk to your therapist, talk to your physician about how to stack and integrate these. And it shouldn't have to always be one or the other. That the H-Wave is a beautiful, beautiful technology that integrates into the things you probably are doing